Try It Out Loud, a podcast by Chasing the Rainbows with your host, Bernice Quisenberry.
Today's conversation is one that we approach with a lot of care and compassion. When weight and fertility come up in reproductive medicine, the conversation often gets reduced to one oversimplified message: just lose weight. And for many people navigating infertility, that advice can feel dismissive, stigmatizing, and incomplete, because the reality is far more complex than just that. Weight is not simply a number on a scale. It reflects a web of metabolic health, hormones, inflammation, stress physiology, along with other factors, and then access to care for this. And for many individuals trying to conceive, especially those navigating PCOS, insulin resistance, or infertility, the question isn't just about weight. It's about how the body is metabolizing energy, regulating hormones, and responding to the environment that we live in. Our listeners know this well. Many of you listening in today have already gone down the rabbit hole of research, reading studies, exploring nutrition, learning about insulin signaling, inflammation, gut health, all of it, and how we fuel our bodies, which then can affect ovulation, egg quality, implantation, and pregnancy outcomes. So today we're not staying on the surface. We're diving into the whole picture of weight, metabolism, and reproductive health, not through shame or simplistic advice, but through science, compassion, and understanding. We are joined today by Dr. Nicole Marchetto, a board-certified reproductive endocrinologist and infertility specialist. Dr. Marchetto earned her medical degree from Drexel University College of Medicine, where she also completed a Master of Public Health. She then completed her OBGYN residency at Mount Sinai St. Luke's, Mount Sinai West in New York, followed by her fellowship in reproductive endocrinology and infertility at Rutgers, New Jersey Medical School. She is also an accomplished researcher whose work has explored pre-implantation genetic testing, racial and ethnic disparities in fertility care, and polycystic ovary syndrome, as we all know, PCOS, areas that intersect deeply how weight, metabolism, and systematic factors influence reproductive health. Dr. Marchetto, thank you for joining us today for what we hope we will get deeper and more thoughtful conversation around health and nutrition and fertility.
Thank you so much, Bernice. I really, really appreciate the opportunity to come speak with you and to your listeners. I remember when we met several years ago at the bereavement conference, and I'll never forget that. This is just such a great organization and so needed for all of us who have gone through infertility and loss. So thank you so much for having me.
Thank you, of course. And we're just so excited to have you and to really talk through a lot of this. When I heard you speak at that conference, you spoke so beautifully, and the way that you really broke things down just gave us a huge understanding of, different things. So I'm really excited for you to be on here for our listeners to hear you share more.
Thank you.
Yeah. So beyond the typical weight conversation, we'll just dive right into these deeper conversations. Many patients, such as myself, feel the fertility conversation around weight, it becomes very overly simplified, like just go lose weight, right? And from a reproductive endocrinology standpoint, how do you think we should reframe the discussion, away from BMI alone and toward metabolic health?
Yeah, so I think that the first step is really speaking to a provider, really, a physician or somebody who is trained in reproductive endocrinology and fertility to really figure out what the person's diagnosis is. So many of our patients are coming to us with recurrent pregnancy loss or infertility or unexplained infertility. And really, it's important to kind of do a full workup and figure out if there is something specific that we can identify as the cause for what they're coming in for. Sometimes weight is playing a role, but it's likely not the only role. And it's important to understand exactly how it's playing a role in their journey. We know that BMI is important, and we know that extremes of BMI do play a role in miscarriage and infertility. At the very low end of the spectrum, patients who are really underweight, the body definitely needs more nutrients to be able to apply resources directly to conceiving, but it's many times more than just a BMI factor that needs to be addressed. So we do a full workup. We want to see exactly what is happening with their hormonal communication from the level of the brain down to the ovaries and how they're really communicating directly with the ovaries and the uterus, to be able to address what the best next steps would be, what the treatments are. And it's not simply going to be gaining weight or losing weight, depending on, what their background is.
Yeah. Oh, that's great. Thank you for sharing it like that. And, BMI is often used as a screening tool in fertility care, but it doesn't always reflect the insulin resistance or inflammation or metabolic dysfunction. How do you evaluate metabolic health more holistically when someone is trying to conceive?
Right. So I think taking a full history and understanding the patient's journey so far. So any medications that they're on, if they've had any drastic changes in weight loss, or weight gain that coincided with their history. If they recently have had a change in their menstrual cycles that were also reflective of what that change in weight has been. We want to know, did they recently are they struggling with depression, and that their weight gain has been associated with depression, and trying to figure out if there's anything else that might be going alongside of the weight gain or weight loss. We know that really BMI is like you said, it's a number, right? So it's BMI is a calculation of the height and the weight, and how it's sort of supposed to reflect the person's overall risk for other diseases, but it's not perfect. So we really can't rely on that alone. And so we want to do other tests to see, do they have any evidence, lab-based evidence of insulin resistance or prediabetes or diabetes? We know that weight has hormonal impacts. So excess body fat can have estrogen effects. We know that adipose tissue can directly turn into estrogens in the body with different hormone pathways that we have. We know that weight can also directly impact the level of inflammation in the body, and that inflammation crosstalks with insulin resistance. Now, it's not super straightforward in terms of how to be able to test somebody for insulin resistance. There are a couple of gold standard measurements that we can use, but are often, not as straightforward to actually measure. So often we'll get a summary hormone, which is the hemoglobin A1C, which is kind of like your glucose summary of the control over the last 3 months. That's a good place to start. I also like to get fasting lab values, a comprehensive metabolic panel, as well as a fasting insulin level and a fasting glucose level. There are some other labs, like I said, that may be described more eloquently in the literature that may not be as practical for our patients to be going in and doing all the time. But we want to get a sense of what is happening sort of in their day-to-day life, their nutrition, their habits, and other medical conditions and other medications that may also be playing a role in that risk. Are they on prednisone for an autoimmune condition? Because that can impact your resistance to insulin and glucose intolerance. And any other risk factors, if they have polycystic ovarian syndrome, so this is going to come out when we do their full history and physical exam. We're going to evaluate how regular their cycles are, what their ovaries look like, some of the other hormone values that we're going to be checking. Patients with polycystic ovarian syndrome also have an increased risk for metabolic syndrome. These are two conditions that really go hand in hand. And so we have to assess for the patient's overall risk for cardiovascular disease later in their life, and really both within a pregnancy, what their risks are, as well as post-pregnancy, and how to make sure that we can keep them healthy and safe long term.
I think taking that overall approach too. I mean, with looking at medications, because I know sometimes the one medication I was put on caused weight gain and things like that too, which also was then affecting, because it was very rapid increase, things like that. So I think mentioning Dr. Marchetto that, looking at everything, okay, let's look at this and see what's causing it, root cause, and really evidence-based than just, trying to guess at it. Absolutely.
Right. And I think too, I see patients all the time, and we do talk about weight and how hard it is to lose weight. And I think that you have to also be practical. And I think leaving a patient with the instructions to just go lose weight is like the least helpful thing that we could do. So I think, having some tools, we often will work with a nutritionist. We also have been starting to use more of the new medications that focus on the GLP-1 receptor agonists, and what role they may play in helping patients who are at particularly high risk of weight gain because of the physiology of their ovaries. And so there's a lot of other, multi-pronged approach that is needed in these kind of conversations.
Absolutely. And I think too, taking in all the stressors, everything that you're dealing with when you're on an infertility journey, and sometimes food is comfort, right? And then to,
Mhm.
try to create another new routine on top of, or, trying to readjust your, food and intake and all of that is so difficult in those moments when you're already trying to navigate so many other things. So love that you say from this compassionate approach, we work with a nutritionist, we help you, we're here for you, we're alongside of you. It's not like we're just going to leave you high and dry and figure it out on your own.
Right, exactly. Yeah, I think that's really valuable, and I think we've learned a lot as a field to really understand that it's not a blame situation, and this is really you have to understand that. And I think we're starting to now that there's a lot more data and more discussion on it. But yeah, I mean, the worst thing that we can do is just kind of abandon a patient and expect them to kind of be able to handle all of this without any kind of other help when it's really their
Absolutely.
hormones and physiology that are affecting it.
Yeah. Well, and the other factors, let's talk through inflammation, for example, and how that, can affect egg quality and, implantation, so many different things as well. And it's really hard to sometimes get that under control or regulated too.
Yeah. So the tough thing, and I talk about this a lot with my patients, especially in the first visit, is there is a whole lot that we don't understand about the body and about reproduction. And I think that understanding that sort of lack of knowledge is crucial in our approach, because we have to be open to the idea that there may be something happening on a molecular level that we have not yet diagnosed or figured out. And so many times when we are working with patients who either have recurrent pregnancy loss or infertility, who are going through maybe the IVF journey, and maybe we're struggling with miscarriages with IVF, we have to think that there is more happening than what we can just detect and measure, and being open to understanding those other pathways and sort of trying different things is important. We do know that high weight and obesity does create a chronic inflammatory state, and there's a host of cytokines, inflammatory cytokines, that are upregulated that function to dysregulate hormone secretion and metabolism. And we know that this can affect egg quality. It can affect embryo implantation. It can affect the environment in the uterus. And again, we don't fully understand all of it. And so there's sort of a different approach for every patient, and trying to figure out what they've tried before, and really what some of these other conditions that might be playing a role could be, and what we can do to help address each of those conditions along the way.
Oh my goodness. Yeah. And right. So when you were saying about like the macronutrients, the micronutrients, what do we know from research with that and the influence it has on egg quality and, the ovarian function?
Yeah, so I think that the important thing is making sure that we understand what nutrients our bodies need to develop a healthy pregnancy, right? So we need all of them, but in different amounts, right? So I think protein, we know, is really important. Sugars are important too. Just understanding the sugars that are going to upregulate your glucose system quicker and less efficiently are probably not as helpful. And again, some patients are more sensitive to certain nutrients than others, and certain patients may have conditions that we have to think about. They may not be absorbing certain nutrients or macronutrients as well as others. So if a patient has come to us with a history of a gastric sleeve or bypass surgery, we have to think about how are they going to get all of the important vital nutrients they need to become pregnant. It's again multidisciplinary, working with their bariatric doctors and nutritionists, and kind of giving them the tools to be able to feel their best as well.
Absolutely. Yeah. And that's right. Like when you're on this journey, self-care, taking care of yourself and having the right people in your corner and the right team really is so vital during all of this.
Right. I mean, I think all of us have been in some part of a journey in our life where we feel like we're kind of lost, and it's so important to have someone in your court to help figure out some of these questions that come up. I think mental health providers, nutritionists, also friends, networks, support groups, because nobody is alone. And I know myself sitting in this seat as a physician, see patients all the time that are going through difficult scenarios. And I've also been on the other side of the table where I'm the patient. And yeah, I mean, it's hard to kind of navigate when you think you're doing this by yourself, but that's why support groups are so vital.
Yeah. Yeah, thanks, Dr. Marchetto, for that. Yeah, and emphasizing that, because it really is, especially, when you're feeling like you're getting hit at all angles, and trying to navigate and figure it out. So, and then this really brings up, and what's interesting is gut health and microbiome, and the evidence around that with reproductive hormones and fertility outcomes. A lot of people have questions around that. Gut health it's almost like a word now that's like going buzzword that's just going around.
Yeah, that's so true. And I think that's an area of research that is blooming and is getting a lot more attention now. And I think that we're understanding that the gut biome plays a really important role in our hormone axis. So as women, our hypothalamic pituitary ovarian axis, in terms of modulating different pathways, men too, in terms of their reproductive pathway, how certain microbes and how really what is going on, again, at the molecular level is playing a role in your hormone level. I don't know that we have really breached the surface. I think we're almost at, the tip of an iceberg when we get down to what is happening and the dysbiosis. We know that patients with PCOS have really a different microbiome than patients without PCOS, and that's probably true for a lot of other conditions as well. But yeah, I think when we look at the link between the gut biome and infertility and inflammation, it's all probably along the same sort of continuum. So I think we are constantly looking for new areas of research, and this is really just hitting the top of the beginning of the understood mechanisms related again to inflammation and really oxidative stress and injury.
Yeah, absolutely. And, I just kind of want to circle back and for this, when we talk about like GLP-1s, and utilizing different things, cycling through dieting, weight, metabolic stress, all of that, how might like that, repeated weight fluctuations like really affect this as well? Because I think trying to keep with a routine or stabilizing, because I'm one that's guilty of a crash diet, right? Like I'll change it for a little bit, and I feel like because I'm so regiment with it, then I real quick go back to how I was eating, because it's frustrating if I break it for a couple of days or something like that. So love your opinions about that as well.
Yeah, I think that the GLP-1s are one of those like sort of huge once in a lifetime discoveries that of course they came out a couple, at least a decade ago, but I think that the impact that these medications are having on so many different body systems is huge. And I think that we really know that obesity and weight health is probably a lifelong chronic disease that is likely not something that can just be treated and left alone without chronic medications. I mean, we kind of see it like a blood pressure. I mean, yes, your blood pressure is probably under control if you have hypertension, you're on antihypertensives, but when you go off the medication, the disease likely is going to resurface. So that's kind of likely how this is going to be sort of addressed long term. And so the question is, okay, well then how do we manage this in the preconception and prenatal time frame? And I don't know that we have an answer for that yet, but we do know that a lot of patients with PCOS who are going on the GLP-1s and are achieving pregnancy because their cycles have become a little bit more regular and they're ovulating more regularly. We're starting to gather more data on what the role of those medications will be in the pregnancy. Obviously right now our recommendation is for patients to come off really when they're trying to conceive, or at the very least as soon as they find out they're pregnant. But I think long term the question is, will there be a world where patients can stay on a GLP-1 during pregnancy to help maintain that symbiosis and homeostasis in the insulin resistance during a pregnancy? But right now, I don't know that we have any good data. And again, I'm not an expert on the GLP-1s, but this is just something that we're seeing, patients coming in with lots of questions.
Absolutely, because it is. It's now that it's easily accessible for people through insurance, things like that. It's getting covered more. People are seeing the need for it, and to really help. It's interesting, especially with looking at that as an option. to really help control your weight or, lose weight.
Exactly. Yeah.
Yeah.
Yeah. So much research in my, fertility world
Yeah.
of what these medications can do for our patients. It's really we're just at the beginning. So
Yeah. Yeah, it's fantastic. I know science, it's always, evolving, and I feel like more rapidly over these last couple of years in the fertility space, and just hoping that continues. So,
yeah, I know we really, as women, we're always looking for more research to be dedicated to what's happening in our patients and in our lives. And I think a lot of fear around research and, pregnancy, and rightfully so. But I think, the more creative ways of addressing some of these questions in the lab are vital.
mm, agreed. Agreed. And so, when they are using assisted programs or things like that, also a lot of times, patients are told you also need to look at how you're fueling your system, like what you're consuming and all of that. Like, what would it mean to actually like fuel the body for fertility, if that makes sense? I know you touched on a little bit with protein and things, but if we could even go into a little bit deeper with that.
Yeah, I mean, I definitely don't think that there is a single diet that is right for somebody who's trying to conceive, but I think making sure that you're getting the specific nutrients, such as folic acid. So we know that that's a nutrient that's required for the beginning of the baby's development of the neural tube, and many times we're not getting that enough in our diet alone. And so the general recommendation across the board is, if you're of reproductive age, even if you're on birth control, to be on some form of a prenatal vitamin that has folic acid in it, so that in the event of a spontaneous, unintended pregnancy, that early time frame is protected. So folic acid is a nutrient that it should be in every prenatal vitamin. You should be on at least 400 micrograms a day, and there are certain populations that may need to be in a slightly elevated dose. For example, for twin gestations or a history of a neural tube defect. So that's like the most vital thing that we can recommend across the board, that everybody should be on. And then outside of that, in our patients, we're worried about egg quality, and we're always looking for any kind of nutrients, vitamins or supplements that might be helpful for egg quality. The only real one that we have, right now that I can say, with certainty, is coenzyme Q10, which is an antioxidant that is really great. It's marketed for like heart health, but it's something that can help improve egg quality. And, it's not a magic pill, but this is one of those things that people are always looking for something extra that they can take. And there's some other supplements out there that, are still being studied. But that one we're pretty clearly recommending across the board, along with the folic acid. Otherwise, I think I tell my patients that, we see a lot of these things as inflammatory disorders, where, if you're kind of looking at ways of life, anti-inflammatory type of approaches is always going to be great. So, avoid any kind of toxins like tobacco, chew tobacco, smoking, cigarettes, vaping, nicotine, anything that is going to increase risk for oxidative damage is probably not going to be great for egg health and sperm health, and for pregnancy. We have a lot of data that is all true. So I think just trying to lead a cleaner lifestyle in terms of avoiding some of those modifiable risk factors is helpful. And again, there's no magic bullet. Sometimes there are things that we really cannot avoid. Sometimes there are genetic predispositions to conditions that we can't really address. But to the much of the ability of being able to kind of avoid some of those things, binge drinking, and some of the things that we know probably aren't great for your overall health.
Absolutely. Dr. Marchetto. Yeah. And well, that leads into, what things outside of significant weight change do you see too, like sleep patterns, rhythms, things like that, that can maybe be changed in someone's lifestyle or, life to help with fertility?
Yeah, I mean, again, I think some of this is what we have control over, and some of it is not. So if you're, an RN working night shift, that's your job in your life, and so, that's not one of those things that you can necessarily change, and we don't really know the overall impact, and it probably does not have the same impact on one patient over another. But sleep is important, and having some sort of a routine with sleep is good. What I can say is that some patients, if you're worried that you're not getting a restful sleep, or you feel like you're somebody that snores, or you're waking up in the middle of the night gasping for air, I would definitely recommend a sleep study, or asking your doctor about, whether or not you are a candidate for workup for obstructive sleep apnea. We know that sleep apnea is a condition that can limit your oxygenation overnight. It can definitely affect, your blood vessels, can put you at risk for blood hypertension and pulmonary hypertension, both which are big precursors for cardiovascular disease. Probably has an impact on egg quality and sperm quality as well. So, we will often, as part of our assessment when we're kind of evaluating a patient, talk to patients about, their overall patterns of their day-to-day life. And if they're really not getting a lot of sleep because of something like this, that might be something that you could be addressing with an intervention like a CPAP machine. This is, again, something that you would talk to with your primary care doctor. But yeah, sleep is crucial. We can't all sleep all the time, as much as I'm sure many of us would like to. But yeah, to the best of your ability, knowing that everybody has busy, hectic lives, you want to be sure that when you are sleeping, you're getting some rest.
Quality sleep. Absolutely. Wow. Thank you so much. And I would love for us to close with, if someone listening feels like they've tried everything, changing diet, exercising, doing all the research, and still feel stuck in their fertility, what would you want to, leave with them with, and any advice that you have also, Dr. Marchetto?
I think knowing that you're not alone is always a really important message. So, I have the benefit of, like I said, seeing patients every day, that I know that, as a patient myself, that I am not walking alone through any of this, because I see how many people are affected by all of these different things every day. But I know that patients are not so aware, because this is something that not everybody talks about. So just know that you're not alone. There are support groups out there, such as Chasing the Rainbows, and really seeking out help and seeing a reproductive endocrinology and infertility specialist. We are physicians who are trained in OBGYN that then subspecialized in reproduction and fertility. And really, it's important to kind of have somebody who has that background be able to assess what's going on and how we can help you.
Great. Thank you so much, Dr. Marchetto, for being on here, for sharing your expertise, your perspective, and a deeper understanding all around this. Thank you very much.
Yeah, thank you. Thank you so much. It was so good to see you again. Hopefully we'll talk again soon.
Absolutely. So great to have you on. To everyone listening who may be navigating infertility, or stillbirth, infant loss, any type of pregnancy loss, please know your story matters, your baby matters, and your grief matters. Healing doesn't follow a timeline. Trauma and loss don't have a schedule, and you deserve compassionate care through every step of this journey. If this conversation resonates with you, please share this episode with someone who may need to hear it as well. And if you are looking for support, want to volunteer, donate, host an event in honor of your baby, you can learn more at chasingtherainbows.org. Thank you for being here, for listening, and for continuing to break the silence around infertility and baby loss. Until next time, this is Cried Out Loud.